What is norovirus gastroenteritis? Let me explain. Norovirus gastroenteritis is caused by a virus called norovirus. There are many different strains, so you can have norovirus infection now. When you recover, you have the resistance against this strain. You can have it again if you're not careful because there are several different strains. So it's a virus that causes infection. It can go to the stomach and make the stomach produce more acid. It can make the stomach go to the stomach also to make the stomach stop it from moving forward. So the food gets stuck and they vomit out. It can also pass down to the small intestine and the large intestine and cause local damage and they present with diarrhea. So the four cardinal symptoms of food poisoning: fever, tummy pain, vomiting, and diarrhea. How do we confirm the diagnosis? By the history, they might have the symptom to suggest a gastroenteritis or gastric flu. We have a special stool test called the GI-PCR panel that can test for all the viruses, bacteria, and parasites, including norovirus. So if you run the test, I get the results a few hours after we submit the stool sample. We can confirm that. If you come to the hospital or the clinic, besides checking on the presence of the virus, I will also check on your hydration status, on your salt level, on your kidney function, because very often people with norovirus gastroenteritis can have severe vomiting and diarrhea. They can be severely dehydrated, certainly the top up. So how do we treat norovirus? At the moment, there's no antiviral therapy for norovirus, so patients will get well by themselves. We just have the support. We give them medicine to reduce the diarrhea, medicine to reduce the vomiting. We give lots of intravenous drip or oral hydration to replenish the salt and water. Patient wait for a few days, 3 to 4 days, they will recover. Very rarely will they have any symptom last more than a week. So most of the time, a few days of rest, eating a lot will be okay. If they don't want to be stay in hospital, that's fine. They can try drinking porridge water or coconut water or just plain water. A lot of them, they have to replenish the salt and water and they'll be okay. How is norovirus, norovirus outbreak occur? Norovirus transmission is what we call fecal oral. So if I have norovirus, my vomitus will have the virus. My stools, my motion, my poop will also have the virus. If my poop go to someone else's mouth, they can have the infection from me. If the vomitus I get into another person's mouth, they can also get it as well. So it's either vomitus or the feces that spread the infection. And there are several settings that we often see in the public. Number one is the healthcare facilities, nursing home, hospital. If we healthcare workers are not careful, we can easily bring the virus from one patient to another patient. For that matter, if you're admitted to the hospital, at least the one that I practice in, you'll be isolated. That means nurses coming in and out, they wash hands with soap and water. All the bed sheet, all the diaper, all the underpants will wash them separately, so as to reduce the chance of the virus passing from room one to another room. We'll put the patient on a single room so they don't pass to the next bed. Number two, it can also pass among the cruise ship. In the cruise ship, they enclose place. If someone had norovirus, they're going to spread to the whole cruise ship. So norovirus outbreak that's why cruise ship food poisoning outbreak almost always norovirus, and it can be very bad. There'll be one case in Italy that the cruise ship, tons of the people get norovirus and they need help, but the port in Italy stopped them from stopping. They say, ours is a small town, we can handle several hundred of people with food poisoning. You spread to the whole community. We don't let you park the cruise at our city. Ethical logistic nightmare. So cruise ship. Second thing is people have reported norovirus outbreak in military camp because people live very close to each other, and if they don't have a good isolation facility, a soldier in a military camp that are vomiting or have diarrhea, if you don't isolate them properly, the vomiting or the feces spread to other people. It can cause a huge outbreak in an army camp. Outdoor camping. When I was a scout, we go camping. If someone vomit and diarrhea, we don't have the proper isolation facility to isolate the person who is sick. So often it spread from one person to the whole troop. I recently have a patient that went to pilgrimage in India. I think about 30-40 of them, actually 30 plus of them actually go to this temple that in the deep in the mountain. So among the group, 6 to 7 had the problem. Eventually they spread to him. So because when they move together and they don't have an isolation facility, it can spread to the whole group. He gets through a pilgrimage camp, scout camp. Also, if you live with someone with the infection, so if someone in the family had norovirus, quite common, the spouse, the children, the parents, the helper may spread it may spread it to them and vice versa. And I often see sometimes more than one person in the family having norovirus. Also in schools, there have been one big outbreak in some schools in Singapore in the past. When you trace back, it's often the dirty food. In the dirty food, if a food handler have the virus, they can spread to people in this school. Pupil hygiene are not so great. They spread among themselves, so there can be more than 100 people falling sick over a few days. Restaurant. If I'm the chef or I'm a waitress or I'm the waiter, I am recovering from the norovirus. My poop and my vomitus may have the virus. If I clean myself after I pass motion, I don't wash hands properly, I cook, I carry food to you, I clean the table, I can easily cause another outbreak in the restaurant. Also, when you go to eat in the restaurant, food that are not cooked, what we call ready to eat food, such as ham, salad, prawn salad, whatever food that we don't cook, they can also be easy target for norovirus to spread for the food from a dirty food handler. So these are all the potential outbreak. When should you see a doctor? When should you be admitted? When should you go to the hospital? When norovirus is a self-limiting disease, you will get well after a few days. But if you have severe volume depletion, if you're severely dehydrated, then you may need to see a doctor for rehydration to control the symptom. Sometimes we admit patients like that for intravenous hydration. How do we tell? For a layman, look for three things. If you every time you pee every few hours, when you're severely dehydrated, your kidneys shut down and you stop peeing. If you have a diarrhea and vomiting symptom and you suddenly feel that, hey, I'm not peeing for the whole morning, maybe you're too dehydrated, you need to see a doctor or maybe get admitted for hydration. If you have a reduced blood volume, also you will feel dizzy, you feel see stars, and when you change posture like from sitting up to standing, from sitting down to standing up, a change on the posture make you feel a bit giddy and dizzy, that may signify that you're having a low blood pressure. Lastly, if for very old and very young, when you suddenly feel very tired, for the young children suddenly become very grouchy, cry a lot, maybe they are dehydrated. So when they have all these symptoms, bring to the hospital. To sum up, norovirus is a common virus. It causes gastric flu or food poisoning. They have 4 symptoms: vomiting, diarrhea, tummy pain, and fever. They are self-limiting, they will get well, they almost always get well. If you have signs of dehydration, go to see a doctor or even go to the emergency department to be admitted. Hope this helps.